I am coming to you from the CEO Conclave 2026 organized by CMI University Department of Placements at the Lakeside campus at Baglo. I'm being joined by Mr. Santhosh today. Very glad to have you, sir. My first question to you is, today we discussed the future of workforce. We were answering some very relevant questions for the students. From the sector that you are in, what are your insights and your general observations about what students should equip themselves with for future?
What actually I can say for this, basically I'm from healthcare industry. So most of the cases I have seen here, everybody is talking about AI. So yes, AI really works for the business owners and the future technology we are going to adopt in the technology-wise, the business and healthcare domain, a lot of things. For students, my advice is don't use AI right now. So focus on your syllabus as well as the process. So that is my insight from my end.
Yeah, that's a very interesting suggestion from you, considering many countries, for example, like Australia, have banned students under a certain age from using technology, for example, smartphones and things like that. So, but this is a very interesting perspective because everyone is telling students to learn AI and be adaptable and kind of play with it and understand it for the future. But how does it operate in the field of pure sciences, for example, and health science especially?
Yeah, in the health sciences, again, the answer from my end is, see, we have gone through the syllabus in the college as well as we have gone for extensive research and technology. Today, what we are. So, AI, yes, absolutely, it will give you answer. If you can write more 5 or 10 PhDs also, if you wanted to do in a year, you can do it by using AI. But what prompts you are giving, as well as through that, what value you are going to create. Not only the giving a prompts or some topic selection, you can use AI at certain limit, not to everything. That is what my suggestion.
What do you think are the future ready skills that students should equip themselves with apart from AI?
Apart from AI, academically, you should be so strong. Any questions, you must answer. Means you should have that level of knowledge. If you are acquiring knowledge more and more, it will be worth to continue in this particular domain as an healthcare.
Do you mean extra academic language knowledge as well?
Yes. See, generally what will happen in every university will have their own syllabus and government is having their syllabus. But what happens in the domain, if you come to, I'm from medical laboratory diagnostics. In the diagnostic segment, people are aware of only few tests. But there are more than 4,500 plus blood tests are available. And anybody, if you ask anybody, they tell hardly under 150. That is the test names which people are currently aware of it. So I suggest that what is the test, what sample has to be collected, those things, because in CMR have introduced allied health sciences. So in that perspective, I'm letting you know that most of the students must aware of the number of tests available, why we are doing the test, and those things has to be, they have to learn.
A person who's working in the healthcare industry yourself, what are the advancements in your field that you're particularly excited about?
The advancements, like currently I'm working on something, one brand I'm launching very soon. It is Consult AI. In the AI segment, I've seen the multiple problems where patients are facing it. Considering the rural area, patients are not getting the access to the specialist. So that is one scenario I've taken, and as well as one other scenario from global level challenge, US and other countries where they don't get the appointment for specialists. Those both things have synergized and created a platform. Patients can create an account with us and immediately they upload all their medical data. AI will analyze and it will give you the recommendation of whom you have to consult, which consultant. So you just select the consultant name. It will redirect to the consultant and all the original reports, AI summary will be sent to the doctor, and doctor will come to the video consultation and he will evaluate the reports and he will give you the suggestion. With this 45 minutes, your job will be done. The same thing if you wanted to do, it takes 2 days, 3 days. You find out the doctor, ask family members. All these things are there. So AI, yeah, I'm also using AI for something noble cause. I'm not using for writing emails, doing things. No, at certain level we should use. We are using for the future, for the society, and for the patients. And I'm working on it. And second way of doing it, AI phase 2, what we are developing, most of the ICU cases I have seen. In the ICU, what happens, the live data, what is coming, we are capturing that data, integrating into AI, and we are giving the prediction to the consultant what is going to happen, what may happen. So based on that, doctor can take an immediate decision that what treatment has to be put. We are not replacing doctor or the technology or anything. So we are replacing with artificial intelligence. Very limited things we are utilizing here, and helping the doctors and the staffs to attend the patient in a proper way.
That's very interesting to learn. Thank you so much for joining us at CMI University today and sharing your views on these very interesting topics, especially on healthcare. Thank you so much for joining us today.